Hi, my name's Jennifer. I'm going to do a head-to-toe assessment of my patient here. And what is your name and date of birth?
Trisha Grisant, 4/22/76.
Very well. And do I have your permission to videotape an assessment of you?
Yes, you do.
I do. Okay. Do you know where you're at right now?
I do. I'm in Skyridge Hospital.
Do you know what year it is?
2018.
Do you know why you're here?
I'm here to get my assessment.
Yes, thank you. And do you know who the president is?
Trump.
Very well. So she's alert and oriented. We've already done vital signs and checked her height and weight prior to this. Her vital signs are stable. I'm just going to do an assessment of your scalp first. Okay.
Okay.
You don't have any itching of your scalp or anything like that?
No.
I'm just going to check for any indentations, asymmetry, look for any critters or any types of like psoriasis or plaque on her scalp. And I don't see any. So next I'm just gonna check your temporal arteries, check for a pulse. Okay, and I'm gonna check for cranial nerve 5. Could you clench your jaw? You clench your jaw. Very well. And cranial nerve 7, could you open and close your eyes? Could you smile? Can you frown? Puff your cheeks out. Cranial nerve 5 and 7 are doing just fine. Now I'm just going to check your sinuses for pressure. Do you have any pressure in your sinuses?
No.
And up here?
No.
No? Okay, let me check your eyes. I'm going to look at your pupil reaction for 1. And her sclera is white and lacks any yellowness. And that looks good too. It's not super red or anything like that. I'm going to check cranial nerves 3, 4, and 5 and see if you can follow my light with your eyes without moving your head. Very good. Now just watch my light as I move it in towards your nose, okay? And keep your eyes focused on my light. And her eyes did accommodate to the light and her pupils did react to the light just fine. And then I'm going to check your ears. First I'm gonna just look. Do you have any pain in your ears?
No.
Or notice any drainage?
No.
Now just palpate her ears. Then I'm gonna look inside of her ears. Oops, my light turned off, sorry. I don't see any extreme redness or drainage or earwax. Can you show me? And that looks very well. And then I'm going to check cranial nerve 8. So I'm just going to occlude your ear over here. And then I'm going to whisper a word and you tell me what I say, okay?
Okay.
Okay.
Fog.
Very good.
Storm.
Very good. Excellent. And now I'm going to check out your nose. Your nose looks midline. Let me get another thing to look up here. Have you had any drainage or pain inside your nose?
No, I haven't.
Okay. Looks good. Septum doesn't look deviated or anything like that. I'm going to check your cranial nerve 1. Can you smell what this is? Oh, I'm supposed to hide it. Cover your eyes first. Can you smell what I have?
It smells like vinegar.
Very good. So cranial nerve 1 is fine. And cranial nerve 12, could you stick your tongue out and move it side to side? Cranial nerve 12 looks good. Now we're going to look at her mouth. Let's see. Her lip color looks good. It's pink. It's not cyanotic. Her lips aren't chapped or dry, no sores. So there's no problems there with the lips. And now I'm going to look inside your mouth. Oops. Okay, you open up. Here, I can use this light some more too. Very good. Can you say ah?
Ah.
Very good. And let's see if her gag reflex is present. Oh, she has a good gag reflex. And that means her cranial nerve 9 is good and intact. And you can talk and swallow just fine. So
yes.
Your cranial nerve 10 is just fine. Now I'm just going to assess your neck. I'm going to check for some lymph nodes first, see if you have any lymph node inflammation. You haven't had a sore throat or anything, right?
No.
No. And could you look up and over that way? And I'm just looking for jugular distension, which I see none of. Now I'm gonna feel for your carotid pulses. And they're good and present. Now I'm just gonna listen to her carotids and see if I hear a bruit of some sort. And that sounds good, very well. And then I'm gonna have you move your head up and down, like nod, and side to side, and then kind of shrug your shoulders. So her cranial nerve 11 is intact. And then I'm going to check your arms. I'm gonna first check your radial pulses. Very good. Let me see this one. Very good. I'm just gonna check your skin trigger. That looks good. You're well hydrated. And your capillary refills. And that is good on that hand. And it's less than 3 seconds. Then I'm going to look at her joints. They all look pretty equal. You don't have any soreness in any of your joints?
No.
No, they look equal. They don't look swollen. No pain with grasping or repetitive activity. And then, do you have any problems with your elbows at all?
No.
No. Let me check this one. Very good. And then I'm going to do, I'm going to have you squeeze my 2 fingers. Okay, and then I want you to hold your hands up like this. I want you to push against my hands. Now pull back. Very good. And now hold your arms out for me. And there's no noticeable drift or anything, so that looks very well. So now I'm going to move on to your lungs. Okay. Start with the left upper lobe. Take deep breaths. Okay, could you just sit up for me for a moment so I can listen to the back? Take another deep breath. Okay, you can lay back now. And then I'm just going to listen to her heart for a full minute. Very good. That's very good. Her heart rate's 69, and we like to see it between 60 and 100, so that's very well. And I don't hear any murmurs or any extra noises in the cardiac area. I'm going to listen to your stomach here. I'm just going to lay you flat. Your stomach looks pretty symmetrical. I don't see any bulging of any hernias or anything like that. I'm just going to listen. Bowel sounds are active, and I'm just going to press. Tell me if you feel any pain.
No.
No pain anywhere?
No.
Do you have any constipation or anything?
No.
No constipation? No problems urinating?
No.
No problems with, diarrhea or eating or anything like that?
No.
No. Okay, then I'm just going to check your legs next. Let me pull up your pants. 'Tis the season. So her legs are good in color. They're nice and warm. They're not cool to the touch. I'm going to take off her socks. I'll check her pulses. That's very good. And I don't notice any edema. I can push on the shin bones and see if there's any edema. And I don't see any. Her toenails are beautiful. I've noticed no fungus or any growths. No sores or open areas. They don't smell too bad. And it's very well. And that is the end of my assessment. She's in good health. I don't see anything wrong with you. Do you have any health complaints?
No, ma'am.
No complaints?
No.
So overall, she's in perfect health. Thank you very much. Have a good day.